You as a future doctor, what do you think? How would you like to be addressed? So let's get the answer from you first, and then we will probably dissect that.
What I believe is that AI should be assisted for the theory part to learn the dynamic medical education, and then the clinical rounds and all should be should be governed over by the senior consultants. But I think AI has a lot to play in the learning part of the medical education too. I really think it would help the medical education a lot too.
I'm sure a lot of youngsters like you are probably you're echoing their sentiments, but I'd like to get Hemanth's input. What do you think, Hemanth?
I think that is the way forward. Now, if you look at what we thought as surgeons, learning a skill is the most difficult thing. Learning a surgery, you'll have to see, you have to do, and you have to assist, do, and then teach to learn a surgical procedure. But today, my residents have the best of both worlds. They work with us, and they also, there's, I would say, a lot of democratization of learning process, thanks to Google, thanks to YouTube, and so many platforms. But there's so much of, a lot of my residents today learn from watching YouTube videos. The learning curve becomes, probably AI has a role in sorting that thing out. And going forward, absolutely yes. I think that is one of the first things which will fall in terms of expertise and all will be teaching learning, because everybody is on an even keel there.
Well, at least I can talk about UK. All our medical students now have access to AI. So the classroom teaching, that concept is slowly fading away. I'm a senior lecturer in King's College, London, but slowly we are losing, children are losing interest, the medical students are losing interest. They say, well, I'll just have AI software. I'm going to learn from the AI software today. Our radiology residents are doing that. Everything is available at the click of a button. So touch screen, anatomy, you name it, cross-sectional, everything. So I think AI can be used very well because you can do it at your own time, at your own pace. You don't have to, wait for one particular class. If you miss that class, then, it's never repeated. So all that can be done. So there are lots of upsides, a lot of good things about that. I totally agree with you. Thank you so much again. Thanks, Hemanth. And thank you for the wonderful question, thought-provoking question. Now, I'm going to introduce my good friend, Dr. Anup Sharma. So he's a very interesting person, brilliant biodata. He's a faculty and a research scientist in the Department of Surgery, the Yale School of Medicine in USA. He was there for 30 years, am I right?
15.
Okay. But he spent a lot of time there, and now he has moved to India because he has come up with some brilliant ideas, and he's going to implement them here in India. So we have plenty to learn from him. So, Anup, so what do you think are the first challenges you have faced after coming to this country from where you came?
Just a correction. So basically, I'm still thinking to move back again on the human side. But it's been a great challenge learning both in India as well as in the United States. So my background is not into medical profession, but it's more of from the angle of a science. I'm more of a research scientist looking from the aspects of understanding how the cancer develops, how it progresses, and how we can do better to understand that, right? That's the key questions we are asking. So one thing I've learned while being at Johns Hopkins, did my training out there, and then now I'm a faculty at Yale. So the only question that I'm trying to understand now is, before we understand the disease, are we really doing better in learning ourselves, getting ahead of the curves, right? Some of the key questions have been raised in the audience as well. So one benefit what USA gains is focusing more on the science, on the research, on the innovation side. So are we doing that? So we have to address that questions from our side. If we can do justice to understanding science, research, then we would be able to understand the disease. And one of the comments raised from the audience, as well as very elegantly commented by Dr. Hemanth, when he mentions that AI is more of No, it's a tool, right? So it's a complementary friend to us who can really help us see or better ourselves accordingly. So I think that would allow us not only to understand science. So from my aspects, when I'm looking at solid tumors, for example, pancreas cancer, right? It differs so much from other cancers like CRC, colorectal, lung, or breast. It's a major difference. Still, we have not been able to actually understand or achieve the survival differences between pancreas as well as colorectal cancer. The reason being, it's a different cancer by itself, in its nature, in its diagnosis, in its prognosis. Reason being, it's driven by its stroma or its microenvironment. So we have to understand what is the microenvironment, where are we placed in. The moment we start understanding that, we would be able to focus on developing better biomarkers, better therapies for these patients, which we are dependent on us.